Well, it's as if they came with their war stories, but it wasn't about the war.
That's right. It's about how our veterans are being treated at VA centers. ABC 2 News' Christian Schaefer heard the good and the bad tonight in Rossville. Chris?
Yeah, that's right, Jamie Kelly. 81 days. That is the average wait time for new patients looking for primary care at the Veterans Facility in Baltimore. According to a federal audit released today, it now appears our facilities here are not immune to problems surfacing in other parts of the country. If you're looking for war stories, the Rossville VFW Hall is a pretty good place to find them.
Pain's still there, wakes me at night. Same problem that I had when I walked in there in July of 2012.
Usually, they're about the enemy, though, not employees at the VA hospital in downtown Baltimore.
The people that receive them and kind of give them unwelcome, feedback.
Veterans gathered at the hall Monday night to speak with the executive director of the VFW's Washington office.
So what's happened is a disgrace.
He put many of them in contact with staff members who will solve their problems individually. Last month, the head of Maryland's VA healthcare system told our Jamie Costello issues in places like Phoenix and New Mexico were not happening here.
As a veteran, it breaks my heart to see other veterans who are not getting what they need. I'm very happy to be in a system in Maryland in which we individualize care for all of the veterans.
And there have been successes.
I had bypass surgery 2 years ago. VA treated me like a king.
But a newly released federal audit shows the average wait time for new patients at the VA in Baltimore is 80.81 days, fourth worst in the country.
Young soldiers coming back from theater, they are suffering. I can assure you of that.
Master Sergeant Jim Bertram says he's also felt the effects of a recent tour of duty in a war zone. A 4-month wait for an appointment here at home didn't help.
Response to that was, go to the clinic. I said, well, I'd like to get an appointment. They said, go to the clinic, and they'll see you there. I'm like, I'd like to see somebody. They said, go to the clinic. Well, that was the response.
Yeah, wait times for existing patients have been much shorter, but new patients, 81 days. Now, as part of that audit, the VA announced a number of changes it hopes are going to lead to better care for veterans, including trying to fill vacant doctor positions and allowing veterans to use doctors outside the system, then get reimbursed. A bill to enable some of those changes is expected to be taken up in the U.S. Senate tomorrow. Live in the newsroom, Christian Schaefer, ABC 2 News.